Next thing I'm going to show you is just the adjusting table. This is a predominantly Grostic hand adjusting table or Nuka adjusting table, depending on which techniques you guys use. But what's really awesome about it, that's a little bit different than what you would get on the traditional Nuka adjusting table, is that it's adjustable up and down. And what's nice about it is that, say you have a patient who's getting up and off the table that has a hard time getting down to the really low traditional Nuka table, you can actually bring this one basically as high as you want to. High enough too, so if you do test reflexes and do other things, you can have the capacity to do that. But then also when you're going down to check a leg length and do your adjustment, you can bring it down all the way as far as it can go, and then you can get set up, and then you can do your traditional Nuka leg length, Nuka leg checks and see how they're doing and get a nice sight line for that because you're low enough to the table. Also, what's really excellent about it too, if you can just sit up, Jessica, and turn that way, is the mechanism at the end for the headpiece. So the way they have it designed in this particular mechanism is that if you pull the handpiece out, it'll raise the front, and then if you push it in, it'll raise the back. And so you can do that very smoothly. So if you're setting someone up for an adjustment, what can happen is you get it nice and set up to their shoulder width, and then when you have them lay down on your side, and then you can slide it down, and then when you get them on your headpiece, if you need to make any adjustments at that point, you can see where they are relative to where they should be, and then you can change the head position by the headpiece itself incrementally, which is really nice, as opposed to having to lift up the head, move the headpiece. And even here, while they're there, if I thought I needed to shift the head up further on the headpiece, and then I could change it and make sure she's just right. So that's some of the benefits of this table, is it's really smooth, really easy to handle, and then make adjustments on the fly to how the position of the headpiece and the shoulder and everything is when you're right on the spot with the patient. So it makes it very easy, very quick for you to do adaptations during the adjustment.